My name is Jamie Reeves. I am an orthopedic surgeon at Town Center Orthopedics, specializing in total joint replacement surgery. I joined the practice in 2010 after completing a fellowship in joint replacement surgery. I have a particular interest in anterior approach hip replacement and outpatient joint replacement surgery, including both hip and knee replacement. Anterior approach hip replacement is a technique of doing hip replacements where the incision is made on the front of the hip. And in our approach to access the hip joint, we don't have to cut any muscles. The advantage of doing this is that when you recover from your hip replacement, we're not having to spend as much time to rehabilitate those muscles, and the recovery is much faster. There are many advantages and disadvantages to all types of hip replacement surgery, whether it's through a posterior approach, direct lateral approach, or an anterior approach. In my opinion, there are significant benefits to anterior approach surgery. The most important benefit is a faster recovery. In general, because we don't have to cut any muscle while performing an anterior approach hip replacement, patients are able to transition to a more normal gait and normal lifestyle in a more rapid fashion. One of the best things about anterior approach hip replacement is that there seems to be very little pain after surgery. It's not uncommon for my patients to say that they don't use any of their narcotic pain medication. And if they do, it's usually only for a few days after surgery. In fact, most patients are able to be discharged home from the surgery center or the hospital on the same day of surgery. One of the best things about anterior approach hip replacement is that the recovery is pretty quick. In fact, most patients don't require any physical therapy. In general, patients will use a walker to ambulate for a few days, maybe up to a week, and then a cane for another week or so. It's not uncommon for us to have patients who are driving in 2 to 3 weeks after surgery, walking unassisted just a few weeks after surgery. In general, after anterior approach hip replacement, we don't have these strict, what we call posterior hip precautions that were traditionally used after posterior hip replacement surgery. And what that means is that we don't necessarily have to limit patients to flexing only to 90 degrees. We do tell patients to avoid extreme ranges of motion. We do want the soft tissues to have time to heal. But that being said, there aren't nearly as many restrictions after an anterior approach hip replacement. When determining the right approach for a hip replacement, there are many factors we take into account. Most importantly is the patient's anatomy and the deformity of their hip as a result of osteoarthritis. There are some occasions when we may recommend an alternative approach, such as a posterior approach. Such indications may be prior surgery from the back of the hip, prior fractures with hardware that's in place that might need to be removed. So the important thing is to remember that when we discuss surgery, the decisions are always made with an individualized approach relative to your specific condition.